I'm Wendy Wilson, and I'd like to welcome you to a special edition of Realizing Potential. Today's show is entitled Intersection of Food Insecurities and Health Disparities Impacting Local and Global Communities. A very relevant and timely topic. And so, what I decided to do was convene some our local and across the nation experts. Very fortunate that they all have a connection to Albany State University. And so, with me today, I have Dr. Veronica Adams Cooper. She is a professor here at Albany State University. I have Miss Danielle Towns. She's a former employee, but still making an impact here in throughout Southwest Georgia, throughout the country, and then an alum of Albany State University who was working at Weill, Cornell. She is Dr. Melisa Davis. Ladies, thank you so much for joining me today.
Thank you.
I want to share with our viewers just the way that you have been able to make such a huge difference throughout your profession, whatever your chosen industry that you serve in. And so I'm going to read your bios because I think that's important so that we get a gauge as to, or they have a better understanding of why you are such phenomenal women and making such a great impact. Dr. Veronica Adams Cooper is a professor here at Albany State University, and she serves in the public administration realm. She serves as the director of the Lois B. Hollis Center for Social Equity, the public service unit for the MPA program here. In her role with the center, she's currently serving as a co-project director with the project director, Ms. Joanna Davis, and also working with the ASU Center for Excellence for Community Engagement, for ASU partnership with the Food Security Initiative for the city of Albany, Georgia, here in Albany, Georgia, which includes the Georgia Institute of Technology with support from ESRI and participation with various community stake group holders. Again, welcome, Dr. Veronica Adams Cooper. Next guest I have is Danielle Towns, currently serves as the manager of business development and partnerships for the National Math and Science Initiative. She received her Bachelor of Science in Biology from Clark Atlanta University and a master's degree in management from Troy University. Over the last 15 years, Danielle has been a force in STEM education through her work with the K-12 systems, institutions of higher education, national youth-serving nonprofits, and has been an advocate who has championed for access and equity in STEM education for all students, especially those furthest from opportunity. And then last but certainly not least, we have Dr. Melisa Davis. She is currently working on how genetic ancestry impacts tumor, immunological microenvironments in breast, prostate, and gynecological cancers. She's an alum of Albany State University, I know, and the University of Georgia, and is a researcher and faculty member at Weill Cornell Medical College Department of Surgery. Welcome again, ladies. So glad to have you.
Yes, thank you for inviting me.
My pleasure, my pleasure. We're going to start, again, just trying to set the foundation for this conversation. And as I started off, as our viewers well know, particularly those that reside in this particular Southwest Georgia community, one of the highest poorest congressional districts in the country, which then has a ripple effect. And so where you have grave or significant poverty levels, that means it's unemployment, that means there's an inability to provide as you desire for your household, which impacts just the basic necessities. So housing insecurity, but our focus today, of course, is food insecurity and what that means. So not being able to feed your family. And even if you are able, depending upon the location in which you reside, you may not have access to healthy food options. So the issues and the matters become that much more exacerbated. And so it's a significant problem, which is of concern. It affects our students here at Albany State University. And so we are working to develop and expand our food pantry because we have students who are also challenged with that. So let me begin with you, Dr. Adams Cooper. You have worked very committedly to trying to address the problem as it relates to just conducting some research. But before you kind of share with our viewers what your work entails in that area, will you give us just a broad definition of what food insecurity means?
Thank you, Dr. Wilson. And basically, you've already shared food insecurity deals with the lack of regular access to healthy, nutritional food items for a household. And there are 4 levels of food security, meaning you have access to healthy and nutritious food. So we have high, we have very high, high, we have low and very low. And certainly in Southwest Georgia, we fall within the category mostly of low.
I understand. And so let's talk about those food options, which are very concerning. I was doing a little research the other day, and so we have the smaller grocers are saying that they can't remain viable or exist because of the larger box grocers, if you will. So the Walmarts, and I know the Dollar Generals, and I can't think of the other outfit, are also incorporating a grocer section in there. So there's that competition piece, but even with those that are remaining, as you mentioned earlier, the food options are so poor. So they're either high in salt, high in sugar content, which then let's transition over to you, Dr. Davis. How does that affect our overall health? So we can be very critical of communities, high obesity rates, high incidence of blood pressure, diabetes, and just a myriad of health issues. But the direct link is what we eat.
Absolutely. So, I mean, data shows, for instance, in cancer research that, in a lot of research, that comorbidities such as diabetes, obesity, hypertension, all of those things, cancer, are linked to food insecurity, given that what we eat can impact the biology and physiology of our bodies. So for instance, in my work, we study how the immune system responds to cancer. Well, your immune system, and the status of your immune system is directly related to your obesity and whether or not your diabetes are controlled. And so when you think about trying to follow guidelines, we can publish all day long and all year long about trends in healthy eating and what you should eat, but do you have access to that? And I think in the minority community, especially all across the country, every city that I've ever lived in, there's going to be a component of the community that exists at a poverty level where their security in accessing food is, in some instances, not even present. So for instance, outside of Chicago. And when we look at those populations, those are also the same populations that have the most aggressive forms of cancer and or are not responding to treatment well, even when they get access, because there are multiple layers of disparities and social determinants that impact whether or not a patient is going to have a better chance of surviving a cancer diagnosis. But directly, we know, the molecules, down to the molecules of what is in preservatives, what is in high fructose corn syrup. We know the molecular pathways, right? So the genes that are impacted by those molecules in your body, because your body doesn't recognize those as natural compounds and how to handle them. And we know that those are the things that drive a tumor's sort of aggressiveness, right? And so for me, this is a very important question because, I'm not a clinician, but I would like to tell my community, these are the things that we see in our laboratory results. And I'm pretty sure, if we were able to make some changes in our lifestyle, that we would move the needle backwards. And instead of seeing more death from cancer, we would see better outcomes.
Very good. Thank you for sharing this. I'd like Ms. Towns for you to weigh in, and Dr. Veronica Adams-Cooper, you as well. And I want to stay on script, but when you were giving the example, Dr. Davis, about the high incident or the aggressiveness on the south side of Chicago, I immediately went into also, so we're of course talking about the impact of diet and the foods that we eat and the ill effects of that. But I'm also then, what popped in my mind are just the everyday stressors of life.
Mm-hmm.
And so again, back to that, the poverty level and then what that all entails. So I'm originally from Detroit, so neighbor of
Mm-hmm.
Chicago. So I'm thinking
Mm-hmm.
about the weather. If you have housing insecurity, if you're unemployed, all of those things create a perfect storm and impact your health. Yeah. So it's in addition
Absolutely.
to the food options. And so then you're saying, now then imagine having a diagnosis and then trying to just journey through that path with all of
Exactly.
these other variables in impacting your health. Ladies, feel free to weigh in on that. And then Ms. Towns, when you weigh in, would you also then include what your background as it relates to the STEM disciplines and how they factor into our conversation today?
Absolutely.
We'll start with you.
Sure. So STEM education at its core is a workforce solution, which can ultimately change the trajectory of a student's academic experience, but also lead to improved health outcomes. With STEM education, we embrace a cradle to career concept. So we start as early as 3 throughout the course of high school and also through post-secondary to engage them in not only the STEM disciplines, but in developing these 21st century skills that set them up for success at the post-secondary level and also make them competitive entrants into a global marketplace. So as it relates to these 21st century skills, when we are implementing STEM programming, along with the science, the technology, the engineering, the mathematics, we are working to develop students' critical thinking and reasoning skills. We are helping to shape them as contributing members of a collaborative who, through intro to design thinking and theory, can unlock creativity and spark innovation. So we know those things, in addition to setting them up for success at a post-secondary institution, also set them up to be successful if they choose to pursue career in these STEM industries. Both approaches really unlock and increase a student's, or at that point an adult's, earning potential. When we have this increased earning potential, as we stated earlier, they're able to put more food on the table to reduce food insecurity. They are able to have access to communities that are safer, where individuals aren't engaging in risky health behaviors, or there are more options for local grocers, farmers markets, more options for healthier foods. They are able to engage in a lifestyle that is healthier just by means of access. That higher income may allow them a gym membership, may allow them to get a Peloton. They may be salaried or have some flexible schedule where they can take a jog in the middle of the day. So all of those things that the higher income provides through the exposure to STEM education and hopefully the pursuit of post-secondary education or entrance into the STEM industry lead to these improved health outcomes.
Very good. Dr. Adams Cooper, if you could weigh in, and then also share, you've done some research and in terms of the grocers and the challenges they were having in Southwest Georgia neighborhoods in a particular area. Some of the challenges that you all have identified or did identify in that research, and then some possible next steps.
Thank you. And I would like to say, just listening to my co-peers here and you, what we can understand is that this is a complex interactional situation where persons who have low income and low progression to get out of those income levels will experience a lifetime of poor health quality and just overall poor quality of life. As it relates to Albany, Georgia, and Dougherty County, in terms of the recent work that the City of Albany has initiated through its Food Security Initiative, what we primarily were doing is documenting what the street committee has said in Albany. We don't have access to quality grocery stores in South Albany and East Albany. And currently we have, and you spoke about the big box grocery stores in Northwest Albany, where income levels are highest. You have the majority of the grocers that provide the highest quality of food, the highest variety of food. So you'll have Publix, you have Walmart, you'll have Harvey's supermarket, and you also have some of the neighborhood Walmart stores. And then what we have in East Albany is one Walmart and one Walmart neighborhood. And so it leaves people with the least opportunity for regular transportation, meaning a car or walking to get to those areas. And then it also leaves people who are trapped in their neighborhoods with the option of going to a gas station or going to a convenience store and listening to Dr. Davis and all of those high fructose products that's there for them, the donuts and the cupcakes and the hot dogs with a high content of fat and whatever else in their salt. It hurts the human spirit to do this research because it's not about numbers, it's about everyday people having this as their only option.
That's right.
And what do we do from the research? Well, prior to the research, I'd like to share that you've had organizations working toward food disparity already. We have Southwest Georgia Project for Education that's led by Mrs. Shirley Sherrod that has been working with farmers, family farmers in Southwest Georgia for the past decade or so, trying to bring their products into a higher market. And they've been trying to get a food hub in the old Winn-Dixie that's on Oak Ridge in South Albany. We also had we have a husband and wife team, Mr. and Mrs. Terrell, who started a Better Way Grocers mobile grocery market that is making stops in several of the neighborhoods that are challenged by food access. And we're hoping that they will continue to expand. So in addition to what the city of Albany is doing, we have I think it's the procurement department, had a recent RFP, request for proposal, for a grocery store to come into South Albany. So we have a variety of actions that are happening. And lastly, I want to share, out of the City of Albany initiative, we have Southwest Georgia Rising, Sowega Rising, led by Ms. Sherelle Bird, that has developed the Food Justice Coalition, and it's called Food Fighters. And it's a combination of several different organizations that are working closely together as community advocates for this issue of food security. So this challenge at the basic level is so important to the viability of Albany, Doherty, and Southwest Georgia, but again, neighborhoods across the nation. Food is fundamental. Back in the 70s, we heard reading is fundamental, RIF.
Yeah.
But fifth, food is fundamental. So we hope that we will continue to spread the word about we need to get back to, if it wasn't God made, meaning from the ground or the trees or from the air, we need to minimize it. I'm speaking for myself, if you can see my visage, that we need to get back to more natural food consumption.
Yeah.
We do.
Absolutely. And I want to just say, first of all, that exhilarates me to hear that there are already organizations, who are sort of at the forefront of trying to solve these problems, because, that was the first thing that came to mind. I grew up in South Albany. And I remember going to Harvey's, and picking greens and peas, and so now when I go back home and I can't find the grocery store and I have to drive all the way out down Westover Road before we can get like a fresh bunch of greens, or I have to go all the way to East Albany, one of the questions in my mind is, how did this happen? Why did all the stores in this area close? And, I'm not sure, of course, we're talking about economic development and economic stability from a city standpoint in that context. But, I'm also an advocate, though, that we have to be our own saviors, in the sense that, Black farmers, bring your food to the community, please. How can we facilitate that? That was one of the things that we did in Chicago when I was there for my postdoc work, in the south side of Chicago, just what you described, that, people who lived in the hundreds, the south side, that's the numbers of the streets. So, the further south you get, the larger the numbers get. And they would have to get their foods from convenience stores. I remember in college at Albany State, we talked about staying on the perimeter of the grocery store, right? All the things that are in the refrigerated section, the frozen food, the fresh food, don't walk up and down the aisles. But when you go in a convenience store, there is no perimeter. Like, you have to take everything off the shelf. And so I'm very inspired and would love to support, these initiatives and amplify them however we can. But I'm also inspired that they're being run by, people within the community. We can't always rely on government initiatives to do the right thing anymore.
Absolutely.
We have to find solutions. I did have a question though for Dr. Adams Cooper.
Can you hold on to that question? We're going to take a quick little break, and then when we return from the break, the microphone's going to be in your hand, Dr. Davis, and you can pose that question to Dr. Adams Cooper.
Okay.
We'll be right back.
Type 2 diabetes can have a big impact on your life, but how can it be prevented? Well, the first step is knowing if you have prediabetes, a serious medical condition that puts you at high risk for type 2 diabetes. 1 in 3 American adults has prediabetes, but more than 80% don't know they have it. The good news is, prediabetes can be reversed, and for many people, healthy changes in their daily routine can make a big difference. Take the 1-minute risk test today at doihaveprediabetes.org.
Viewers, welcome back. I'm having a conversation with Dr. Veronica Adams Cooper, with Ms. Danielle Towns, and Dr. Melisa Davis. And our discussion is on food insecurity and how that is impacting local and global communities, specifically as it relates to the impact with health disparities. Dr. Davis, you had a question for Dr. Veronica Adams Cooper.
Yes, so I heard you mention a call for grants. So I was wondering, to open up the grocery stores. And I was wondering if you could speak a little bit more about that in terms of who would be eligible for submitting this proposal.
That's a great question, Dr. Davis. And to my knowledge, the city's Department of Community and Economic Development have been working towards this RFP for some time, and it was sent to the city's procurement office. Now, the RFP was due September 4th, and so it has expired, but in reviewing it, it was open for various grocers who have the capacity to bring an actual grocery store into South Albany. Now, the particulars of what the requirements are, I'm sure there are industry standards that those grocers would have to meet in terms of their RFP, but the RFP is still located online if one would want to go to the City of Albany's website, to the procurement office, just so they can review it. And if in the future there will be more RFPs, they could be in the process of making sure that their bid would be a viable bid.
Okay, I bring it up because as I was stating in Chicago, one of the things we did in the South Side is we talked to some of the farmers so as you know, Chicago is very close to Indiana. And so there were Black farmers in Indiana as well. And so Dr. Rick Kittles, who was leading the population health program there, sort of created a partnership where the farmers would literally just bring in pickup trucks of fresh vegetables into the South Side every week. They had a specific location where they would just set up a informal, farmers market, often in just the, parking lots of churches, things like that. And so one of the things that, concerns me at times is sort of what are the businesses that are sort of popping up in our communities, and what are the standards, being held in terms of their accountability for food security. There are certain grocers who won't sell things on the shelf that are, quote, carcinogenic, right? So natural foods, things like that. I was just curious, as to whether or not there was an initiative to give incentive for specific types of stores, grocers, markets, if you will, that would highlight and ensure that what's on the shelf, doesn't include high fructose corn syrup, or, to some extent. I know that's sort of pie in the sky, that we would, have that sort of accountability on a commercial business, but, how can we incentivize, providers or vendors who make that their theme, to, set up shop, even if only a couple of days a week, in these communities.
I don't know that it's pie in the sky. And so I think it's just a matter of being better advocates, becoming more learned about the generational impact of these decisions, and then other people making decisions for us and about us. And then holding our politicians, our state, our local, our national representatives accountable, and using that voice. We have so many pervasive ills that are impacting our ability. I'm still struck, and Ms. Towns, please weigh in on this. And so we have you here showcasing all of the different career fields that one can enter through STEM to make a difference. But then I'm also thinking, well, Wendy, if you're hungry, and then the expectation is that I've started off the morning hungry, I went to bed hungry, and then now you want me to go to school and stay focused and absorb this knowledge and information so that I can then enter into these STEM fields. So again, we go back to it's that the ripple effect, if you will. Ms. Towns, will you weigh in on that? I know you've also worked with some in trying to showcase that these career paths to different nonprofit organizations that are youth-based. It's a focus that I want us to kind of center on. And then if you've witnessed that yourself, and then how do you bridge that? How do you make that connection that somehow you've got to move beyond this condition that you're in order to achieve this dream that you have?
Yeah, so I guess I'll start by saying, as much as we realize that education is a driver of opportunity, it's also a reproducer of inequality. And in that reproduction of inequality, it really speaks to some of the access and some of the equitable experiences students of color, students in rural populations, students of a specific gender may face. And to that end, STEM education is very intentional in engaging all the stakeholders of a community. So in addition to our K-12 partners at the school and district level, we have a primary focus on engaging parents and caregivers, introducing them to resources and trainings that may affect their employability and help to bring them to a different economic level. We are very intentional on harnessing the collective impact of a community to provide transformational experiences for students. So it's not just about the programming that you receive, it's more of a wraparound service. So in addition to STEM programs, we have someone at a food bank who's providing nutritional food for these students. It is working with STEM industry partners to provide mentorships and apprenticeships so that students can see not only what the future holds, but see themselves in these professionals. So it really is the cumulative effort of stakeholders within a community that seeks to, again, transform the academic experience and then eventually those outcomes of students through STEM programming.
Yeah, it really is about a holistic experience. And then understanding, all of us are educators in some form or another. A lot of us may have more direct engagement with students on a daily basis, but it is being mindful of, the experiences that they come from, that they bring to the Albany State, to Cornell, wherever it is, to whatever the youth-based organization is. That I'm coming with my whole self, and that is what you have to engage. My thoughts, and I don't know why I went there. Dr. Michael Eric Dyson took Bill Cosby to task in a book some maybe 15 years ago about his criticism of communities of colors and how they engage and how they behave. But the criticism was void and absent of the systematic barriers that are in place that help to create who we are as individuals in those communities. And so everybody on this platform is, I know, very fortunate but we are just one person away, whether they're in our families, they're a neighbor, they're a church member, who are having some very fundamental challenges, whether it be food, whether it be housing, whether it be access to education. Dr. Davis and I, in a previous conversation, and I believe this came up, where we talked about we're in the middle of this pandemic. Some days I don't even want to say it because we're just living it. But I remember reading an article about a young woman who she had 3 children. And so when the pandemic hit, we're sending all children back home for health and safety reasons. And so we're transitioning the educational environment to your household. And so just access it online. And so her only means of communication with the world was her cell phone. And so now with this, I've got to go to work. My children are at home. And then I'm now responsible for their direct education. And so you're saying just connect to Wi-Fi. Well, this is the only device in the house.
Yeah. I mean, that's so unfortunate. I mean, one of the things too that comes to mind, you know, in the research that I do, especially like during the pandemic, right, is sort of this transition now to telehealth, you know, to limit exposures. You know, clinicians are telling patients to only, you know, log in for visits, you know, if possible, but that's only creating a larger gap in terms of clinical services. And so once again, you know, we're going to see emergence of a larger gap in health disparities because now we're so dependent upon technologies that aren't necessarily available. And so school, education, you know, my children, again, you said it, we're fortunate, right? You know, my children right now are logged on the same Wi-Fi, and I happen to be able to have accessibility to broadband that allows us to have that bandwidth. But that's not true even for some of my children's classmates, you know. You know, one of my daughter's best friends, you know, I wonder often, you know, how they're faring in this time. And I want to reach out and say, you know, let me know if we can help. But you know, as a community, we tend to be relatively proud, you know, about who we are. No matter what our shortcomings are, we're not going to ask for help. We're going to try to make do with what we have. But I think that's where education is so key early on, you know, and to tie back into what Dr. Towns was saying, you know, science communication needs to be very straightforward. I shouldn't need to have access to Google to have access to information, you know, and sometimes we are the keepers of knowledge, right? So what you learn, you share that knowledge across the board. You know, if I wasn't able to log in and see the podcast, you know, share the information in various formats, you know, newsletters, if you will, you know, any kind of I'm really an advocate now of community outreach. You know, let's just show up and talk about what it means. What is cancer? What is food security, insecurity? What are high quality grocery stores? Like, what do you mean when you say that my grocery store isn't high quality? I mean, basic information, you know, the fact that we just talked about preservatives, that's what I mean. You know, don't eat foods with high fructose corn syrup. I'm now showing my children that they're old enough to read. Turn the package around and read the ingredients.
Very good.
Sugar, you know, we're limiting sugar, right? They know that, but if you see these words, high fructose corn syrup, do not consume it. So everything that you have, turn it around and look at the ingredients, even in your limited choices. And I understand that where you live, you have to choose, you have options, you have to choose from those options. Even within those options, can you find some options that won't be a detriment to your health, even if you have to go to the quick trip today? Like if that's your only option today, turn the thing around. Like whatever you're about to buy, ask for the ingredients, you know, and just simply ask, you know, ask yourself, read and see whether or not it has different things and different things that are detrimental to your health. And so as a science communicator, you know, Dr. Towns, in the STEM field, you know, early on, let's teach our children about what these chemicals are, you know, and why they're bad, so that even if they start having to make choices with bad options, they'll at least have information to, among these bad options, pick the thing that's the least detrimental, if you will.
Yeah.
I'm sorry, I don't know the full answer, but you know, it's going to take a multidisciplinary, effort to really, make an impact.
Yeah, and that's exactly it. In addition to providing the STEM education programming, we're very cognizant that you can't introduce apps to an old operating system, right? And so with that, in addition to just, again, how we engage young people, we're also very intentional about how we engage their caregivers. So through trainings about nutritional value and food insecurity, or what is a food desert? And if I'm in a food desert, how do I select from the healthiest options?
Excellent.
We're very intentional on introducing concepts of culturally responsive education, right? And so knowing some of the limitations that we face in our community between economic segregation, some of the exposure to mass incarceration and drug addiction, how do we train up and rise above that, given what can be perceived as very limiting circumstances? So that's why, the approach to the 21st century skills, representation, exposure to larger community stakeholders becomes so very important.
I agree. And that's a great point that you make. And that's why I'm so thankful for a Channel 19 or HBCUs or any platform that allows the showcasing of you ladies, because representation is absolutely so critical. It could be one person, it could be multiple Adams Coopers, but it could be just that one engagement with her that can make a huge difference and change the trajectory of someone's life, because then it becomes tangible to me. And I'm that then when you fail to provide that, not only to that child who may not necessarily have direct contact, but to the greater populace, the majority, if you will, who then make decisions and see, because the point that I'm trying to make is you ladies are not an anomaly. And that is what the greater society will try to project, that you're the exception, that there's only a few Adams Coopers. And in my world, I'm very fortunate to know quite a few. But I think, as you said, those that are in those locations or those communities that may not have direct access may not know that it's possible to be a Danielle Towns or to be Dr. Melisa Davis or a Veronica Adams Cooper. And so these platforms are critically important, and we have to be intentional. And as it was said earlier, just make a very conscious decision that we are going to be responsible for ourselves and not rely on someone else to do it for us. And then be able to provide those basics. Back to the origins of this conversation, food. Yeah, just those basics make all of the difference in the world.
So one of the things that I really liked about when President Obama was president and Michelle Obama was, our first lady, I really loved sort of the things I started seeing in like the public health, in the public school system, right? Like all the sugary drinks disappeared all of a sudden out of all of the, vending machines. And you would go into McDonald's or your fast food place and you would see like the nutritional menu up. So, and these were like mandates because of, policies that were initiated under that administration that have now been wiped away. And so now the sodas are back, and I have to, download the app to see what the nutritional value of the food is in the restaurants that I'm in. I want to see some of that come back, sort of voluntarily, or maybe it's something even from, from an HBCU perspective. One of the reasons I'm here right now is because I really feel like, especially in a community like Albany State should be the gatekeeper of the knowledge that our community has to this information. And so, I'm here for that. I want to, somehow project this information into the community in some form. Maybe it's a commercial, right? Maybe it's just, signage that's, around the city that, basically speaks to some of these opportunities that Dr. Adams Cooper was talking about, some of the community outreach that Dr. Towns is talking about, so that it's not a surprise, like it should be common knowledge that these initiatives are underway, and some of these basic science, messaging that you're sending, through the people in your program, plaster it everywhere. Like we need to share our knowledge. I think that, historically Black colleges transformed the ability of people who are the descendants of slaves to be able to have an education and gain this knowledge. And we still have that responsibility in our communities.
I agree. And it could be as simple, and we are working on that. We're having conversations with you ladies. We're having conversations with an organization that is helping to support our food beds and our greenhouses on campus, and just enlightening students and working to empower them. You do have a responsibility. You exist in this world. There is work that you must do. You cannot succumb to it. Although, some days it's like, but you have to keep pressing forward. That's what our ancestors certainly did. And we have to carry on. We'll have to have you ladies come back. But before we wrap up, I just want to kind of go around, weigh in terms of, let's give some hope to our viewers, particularly those young people who may not have that immediate representation on, again, I'm just trying to eat and you want me to do this, and this. Let's give them some hope. I'll start with you, Ms. Towns. Give them some guidance and directions that this is achievable, this is possible through the STEM field.
Yeah, again, STEM is just a great lever to unlock students' potential. And as we think about how it relates to food insecurities and health disparities, the more that you can engage in STEM, the more that we hope to inspire you to pursue that STEM career, post-secondary education. That becomes your access point to higher income, which allows you the freedom to, again, be in safer communities, afford to put more food on the table. But as a student right now, there are so many opportunities, so many programs that you can engage within. So Boys and Girls Clubs of America, specifically Boys and Girls of Albany, has a fantastic STEM program. They have activities where students are planting pumpkins, 4th of July weekend, so they're ready for harvest by Halloween. But in addition to that really fun activity, there's a lot of providing of resources and providing of nutrition. They can connect you to your food bank. They can connect you to grocers who may have discounted programs for you. There are programs at NASA that really aim to engage starting at 4th grade, that takes you through an experience through high school where you have access to internships and year-round programming. So although, it may not be as immediate of an output for students in the pre-K through 12 space, just knowing that STEM education is the entry point that can, again, alter that trajectory for, improved access to, safe spaces that will not leave you locked in a food desert and ultimately improve those health outcomes.
Outstanding. Thank you. Dr. Adams Cooper, you're a public policy expert, do great things in our MPA program here at Albany State University. Can you translate that over to our topic of discussion as you close your particular area or contributions in this conversation, how that then can impact food insecurity and then the direct tie to health disparities and improvements?
Certainly. I would like to share that there is a policy that many people really still don't know about, and it's Public Law 115-102. It was enacted by President Trump, and it is the 400 Years of African American History Commission Act. Buried deep within that policy, there is one clause that I call the impact clause. And it is that the United States would acknowledge the impact that slavery and laws that enforced segregation that it had on the United States. That one little clause is, I believe, the key to helping all of our communities of color and of majority understand when one part of the family is hurting, we are all hurting. And our nation has a 400-year history that must be healed. And from that trauma healing, we can begin to answer and restore in earnest many of these disparities, from housing to education, to food, to health, to our penal system, They all work together once again. And so at the very basic level, food is fundamental. When we look at the history of the African American experience, we were the laborers to bring food and other industry. And so until that understanding is fully embedded in our education system and throughout all of our industries, we don't move forward. So it will be the village. It will be the village. It will be our churches. It will be our sororities and our fraternities and our other civic organizations within the what is called the civil society, working along with government, working along with private industries to come up with viable solutions. And so, yes, when we went into the grocery stores, to the convenience stores, there are some alternatives that can be solved or can be purchased. You have salad items, there are fruit items, there are fruit juices versus sodas, there's water, there's skim milk versus whole milk. So there are options even if you are in a food desert. And then when you go to the regular grocery store, go in the perimeters. And so it's a change of behavior.
That's right.
That change in behavior and mindset does not happen over time. And when you have all kind of commercial ads making you want McDonald's and potato chips and all of the bad things, you have to really have a plan at a family level that says we want to be healthier. And so we will continue with the efforts of the Center for Engagement here on campus with Dr. Lindsay in Student Affairs, and also with the various organizations in the community. And you mentioned Farmer Fernando, with our community gardens here on the campus of Albany State and within the community. We just need a vehicle to integrate and to collaborate so that the impact and the synergy is much broader than just a few areas being impacted. So there is hope. There is hope.
Thank you, Dr. Adams Cooper, for reminding us that there's hope and then giving us a detailed outline as to how we can approach that. Dr. Davis, wrap us up from your frame of reference and your expertise. We're talking about the health disparities. Dr. Adams Cooper kind of gave us a charge in terms of making decisions, regardless as to what our conditions and our circumstances are with those healthy choices, regardless if it's a convenience store or a huge grocer, staying on the perimeter. Being conscious as it relates to public policy. We'll have to do some research on that clause, because you're absolutely right. The vestiges of the institution of slavery itself, it permeates every aspect of our life, and we're still riddled with that. And so we have to be conscious of that and then make those decisions. But Dr. Davis, from the health side of the house, if you will, give us some hope. We're going to make those, when we make those healthy decisions, how does that affect us physically and hopefully increasing our longevity, opportunities for longevity?
Well, I'm a geneticist, so I'm going to bring it back home to my work. Like Dr. Adams Cooper, pointed out that, the fact that we are descendants of enslaved Africans also speaks to our genetics. And that's one of the things that we focus on in my lab. We look at the differences between, the cancer subtypes in prostate cancer and breast cancer across the diaspora. So I have a global oncology program. And so when we look at patients in Africa and the gene networks, if you will, and how they are regulated in tumor progression, why tumors are more aggressive and less responsive to the treatments that are available, more aggressive in the African American community, more aggressive in West Africa compared to East Africa. We know that to some extent, it is an underlying response to the environment. Okay, so it's not about being inferior. Our genetics do not make us inferior. Our environment assaults us, right? And so to what extent some of that is modifiable in the sense that, systemic racism creates a stress response. Some of it has even been shown to be transgenerational in terms of, the African diaspora and sort of the implications of what it means to be stripped away from your heritage, stripped away from your identity. And we can see that imprinted across genes. What I can also tell you is that in the data that we have, we also know that obesity, diabetes feeds into these pathways that makes tumors less responsive to treatment, makes cancer more aggressive. It even makes cancer show up earlier in life. One of the themes that we see all across the board with every type of cancer in the African American community is that we get it sooner and we get the worst type of it. And she's right, food is fundamental. What we eat consistently every day impacts the way that our genes interact with each other. And so that can impact not only your susceptibility to malignancy, but how your disease course progresses. And so what you eat during treatment is very important. The team that's trying to cure you of your cancer isn't necessarily going to tell you how you should eat, but there are people who can. We need to be more invested in, like she said, food securities and making choices, even when you have, an overwhelming, bad options, in front of you, to make the best choice that you can. I would say that the gene interactions and the people of West African ancestry are very sensitive to the types of foods that we eat. But the hope that I would leave you with is to what extent you can find even just one healthy option a day can impact those networks enough that you could have a better outcome. And I'll give you a prime example. One of the things I used to teach in my medical class is we know, for instance, when we eat red meats and we like to have it grilled and, that really salty, crunchy part of the steak, that we really like, the grill marks, that black part of the meat actually has mutagens in it. And, you ingest those things and your cells become mutated because literally there's a chemical that your body, when it metabolizes it, it can damage your DNA. But if alongside that juicy grilled steak, you have some Brussels sprouts or some collard greens that aren't overcooked, those plants also have a chemical that when your body metabolizes it, can neutralize those mutagens. So even if you have all these bad choices, if you make one good one in that meal, it can neutralize some of the bad choices that we have to make. So that's what I would leave people with. And then coming back to the STEM part of things, I need to get that message out, in a simplistic way, instead of talking about mutagens, just talk about these are the options that you need to choose from. Check a box in one of these, food groups once a day. Even if every meal you have can't be full of fresh vegetables, if you just have one a day, check this box once a day. So my hope is that the research that we do will translate to not only educating the community about why making better choices is important, but also eventually maybe some of the discoveries that we make gives us the ability to make sure that the treatments available are actually better. And so when you come to the clinic, we'll have something that works better.
Outstanding. Now I'm ready for a part 3 and a part 4. I was just thinking, I had a conversation yesterday, and it was a panel discussion with the president and a local counselor, mental health counselor here in the area, and we're collaborating on a couple different projects. And so, because it really is a confluence, a marriage of so many different things, and we were talking about mental health and what that diet consists of. And so it really compounds. So if you're ingesting, I was giving an example, I had to log off for a brief moment last week on a Zoom call because one of our great students on the call just was a mirror image of Breonna Taylor. And I had to log off because I was still processing what we learned in the media a couple days prior about how she laid there for 20 minutes and no one even, I know. even bothered to see if she had a pulse or if they could resuscitate or whatever. So I'm still processing that. So my point is, are those external variables that impact us. So what winds up happening, maybe it's just me. So when you're doing that, then you delve over into or transition over into that emotional eating. And so somebody mentioned some chips earlier. That's my weakness. Yeah. So I'm going to, because I need to try to escape that. But sometimes the escaping of reality is far worse than reality, if you will. So depending upon the community, I may not have access to a track or a piece of fruit as opposed to a readily piece of fruit as opposed to, the bag of chips. So again, I could go on, but to bring this to a close, what I've heard all of you all say is that you have to be intentional. You cannot rely on someone else to do it. And those that do have positions of authority in terms of moving the community forward, you then have to hold them accountable. And we have to be intentional with putting representation before our babies, before our students. And we have to be wise enough to have access to a level of information so that we can have intelligent conversations if we do find ourselves, before a Dr. Davis with trying to help us to move past whatever the diagnosis or prognosis is in our lives. So intentionality is going to be critical. So ladies, I've learned a lot. Thank you so much. And I know our viewers have. I'd be remiss if I did not say thank you for your intentional involvement. You all live these lives up close and personal. You're responsible for educating individuals and then trying to, as we are ending this out, with providing them with some level of hope, straddled with all of these challenges. But what you have said is it is doable. Our ancestors did it. It's just a matter of asking, and those that are armed with knowledge or access, you being more involved. And I'm speaking to everyone. So that's within viewing and the listenership out there. But thank you so much for this conversation. Well, we'll have to do it again. We'll just have to put it on our calendars to see what strides we have made. Dr. Adams Cooper mentioned the work within the community. And so what are the next steps 6 months, a year from now? Ms. Towns, your work in terms of educating our young people and then bridging that gap that although you may be suffering in terms of lack of access as it relates to the fundamentals of food, there is still hope for you out there, and here are the ways in which we can navigate that. And then Dr. Davis, your work globally is greatly appreciated, and we look forward to hearing what you are continuing to do in terms of your education and then just healing people.
Absolutely.
Okay. Ladies, thank you so much for joining today. It was certainly my pleasure, and I look forward to having you back on the show.
Thank you.
Thank you.
So wonderful to meet you all.
Well.
Viewers, thank you so much for joining me for this special edition of Realizing Potential. I'm Wendy Wilson, and I look forward to seeing you next time.